On Call, A Doctor's Journey in Public Service by Dr. David Muller is a profound and inspiring memoir that delves deeply into the life and career of a physician devoted to public service. The book traces Dr. Muller's journey from his early days as a medical student to his current role as a leader in medical education and healthcare reform. Muller begins by recounting his formative years in medical school, where he first encountered the stark realities of healthcare disparities. These early experiences in underserved communities profoundly shaped his understanding of medicine's role in society and solidified his commitment to serving the underserved. Through vivid and often poignant anecdotes, he illustrates the challenges faced by patients who lack access to adequate health care and the systemic barriers that perpetuate these inequities. One particular story he shares is about a young boy with asthma who couldn't afford his medication. Muller recalls the helplessness he felt and the determination it sparked in him to make a difference. Another vivid memory is of a community health clinic where resources were so scarce that basic medical supplies were often unavailable. These experiences were not just eye-opening, but also deeply motivating for Muller. These formative experiences laid the groundwork for his lifelong advocacy for healthcare reform and his dedication to addressing the systemic barriers that prevent equitable access to healthcare for all. One of the central themes of the book is the importance of empathy and compassion in patient care. Dr. Muller shares numerous stories of patients who left a lasting impact on him, such as a young girl battling leukemia who taught him the value of hope and resilience, and an elderly man with chronic illness, who reminded him of the importance of dignity and respect in care. These experiences shaped his approach, demonstrating that the practice of medicine is not just about diagnosing and treating diseases, but also about understanding and addressing the broader context of a patient's life. He emphasizes that effective patient care requires building genuine relationships and advocating for patients' needs both inside and outside the clinical setting, driven by empathy and compassion. The memoir also provides a critical look at the medical education system. Dr. Muller discusses his extensive efforts to reform medical education to better prepare future physicians for the complexities of modern healthcare. He introduced a more holistic approach to training doctors, emphasizing social determinants of health, health policy, and community engagement. One significant change was the integration of community health projects into the curriculum, allowing students to engage directly with underserved populations. Dr. Muller also expanded the use of simulation labs for hands-on training, ensuring students could practice real-world scenarios in a controlled environment. His work at the Icahn School of Medicine at Mount Sinai, where he co-founded the Mount Sinai Visiting Doctors Program and later served as Dean for Medical Education, serves as a case study for innovative educational practices. These reforms have had a profound impact, producing well-rounded socially conscious physicians who are better equipped to address the diverse needs of their patients and the healthcare system. Muller candidly addresses the personal and professional challenges he has faced, including severe burnout during his residency, the emotional toll of working in high-stress environments, such as dealing with a particularly difficult patient case that left him emotionally drained, and the constant balancing act between professional responsibilities and personal life. He often struggled to find time for his family, but despite these challenges, his unwavering dedication to public service and his passion for improving healthcare systems shine through. He managed to find a balance by setting strict boundaries and prioritizing self-care. On Call, A Doctor's Journey in Public Service is not just a memoir, but also a call to action. Dr. Muller urges his readers, whether they are medical professionals, policymakers, or laypersons, to recognize the interconnectedness of health and social justice and to take an active role in advocating for a more equitable healthcare system. The book is a testament to the difference that one committed individual can make and an inspiring reminder of the profound impact that compassionate, patient-centered care can have on individuals and communities.